So thanks for everyone to join today. The Children's Tumour Foundation is a support organisation for people living with NF in Australia. Our support team aims at providing hope for everyone impacted by neurofibromatosis in Australia by advocating for change, advancing research, and empowering the community with knowledge, connections, and support needed at every stage of their journey. We have some helpful information and resources on NF, which are available at any time. If you have any questions or would like to get into contact with other families living with NF, you can always call us or email us. We have allocated 40 minutes for Dr. Pride's presentation and around 15 minutes for questions at the end. We ask if you do have any questions for Dr. Pride, can you please either raise your hand or type it in the Q&A or the chat, and we will respond at the end if there is time. We ask that you please keep your questions general, as this webinar is for the NF community and is not a consultation with Dr. Pride. I would now like to introduce Dr. Pride. Dr. Natalie Pride is a clinical neuropsychologist and a researcher with a PhD and master's in clinical neuropsychology and has over 15 years of clinical and research experience in neurofibromatosis type 1, and also leads the NF1 Learning Clinic at the Children's Hospital at Westmead and the NF1 Neurocognitive Research Team within Kids Neuroscience Centre. Natalie has published on a range of topics in NF1, characterizing the cognitive and social phenotype of NF1 and associated neurobiological differences. Dr. Pride was recently awarded the 2024 Francis S. Collins Scholar Program in Neurofibromatosis Clinical and Translational Research and sits on the International Response Evaluation in Neurofibromatosis and Schwannomatosis Neurocognitive Committee, which aims to standardize and improve clinical trial outcome measures in NF1. I would now like to hand over to Dr. Pride.
Thank you for that introduction, Alicia, and thank you to the CTF for inviting me to present to you all today. A little bit more about myself. I'm a clinical neuropsychologist for 15 years, and during that time I've worked with families at the NF1 Learning Clinic at Westmead, and as Alicia mentioned, I also do some research through the hospital with an aim to understand and treat some of the challenges faced by children with NF1. Okay, so today I'm going to be talking about some of these challenges and ways to support them. I'll also briefly go into the New South Wales education system and applying for special exam provisions, and provide a bit of an update on some of the research we're involved with at Westmead. But before we begin, I would like to acknowledge the traditional owners of the land where we meet today. I pay my respect to their elders past and present. It is upon their lands that we meet. Now, just like the medical and physical issues that can happen in NF1, the impact on the brain can also be extremely variable. As such, the functioning of children with NF1 can really vary from one child to another. I wanted to start this talk by speaking about the early years before school, as I think this is a really important period for children, as the quality of a child's experiences during this period influences how the brain develops. Now, research that has tracked infants with NF1 aged from 5 to 14 months of age by assessing their cognition, their parent-child interactions, and their behaviour suggests no differences between a child with or without NF1 at that age. However, after the age of 2 years, our research that tracked development over a period of 7 years, so from babies up to 7 years, indicated that delays can sometimes start to develop at age 2 years, with around 30% of young children experience a mild delay in cognitive or motor skills, and more than half of children experience some type of language delay. Now, there are a range of resources out there to track your child's early developmental milestones. One that I really like in particular is the Starting Blocks website. It provides you with detailed information about your child's developmental milestones at every age. I do encourage you, if you do have concerns about your child's early milestones, it is important to speak to your doctor and let them know so they can link you in with a multidisciplinary team that offers assessments, if appropriate, or allied health interventions. Waitlists can be quite long, so do speak up right away. And just remember that not every child with NF1 will need this kind of assessment when young. It's best to be guided by your GP, paediatrician, as well as your own judgment. There are some things that you can do while waiting. As mentioned, the wait lists are long for developmental assessments. So one thing you could do is seek early intervention to support their development. So this includes a speech pathologist to help your child develop their ability to communicate with language skills, an occupational therapist who can help develop skills for your child to be independent in everyday activities, so things like dressing and feeding, as well as fine motor skills, which are important for writing and playing later on. So I have listed 2 websites here to find a local speechy or OT in your local area. You could also consider applying for funding or support through the National Disability Insurance Scheme, including the Early Childhood Approach. So this scheme supports intervention services such as speech therapy and occupational therapy for children younger than 6 years of age with a delay in an area like language or speech or fine motor skills. So funding mechanisms also do support children under 9 years of age in this scheme if they have a diagnosis of a disability such as autism or intellectual disability. Now, for families residing in the Western Sydney local government area, you can contact Northcott, who will provide you with information and support to refer to the NDIS. Other avenues for funding for early intervention include the Medicare Chronic Disease Management Program. So this can be accessed through your GP or paediatrician, and it provides 5 partially rebated sessions for allied health every calendar year. Now, most children we do see at the NF1 Learning Clinic are of school age. And what I find is a common story at our clinic for those children who do go on to experience some academic difficulties is that they may perform well in kindy or year 1, but by year 2 and year 3, their grades sometimes can start to slip. And this is because school becomes more challenging and kids are expected to work more independently as they progress. Now, as mentioned, NF1 doesn't really have a particular size or shape. It's different for everyone. But some of the common challenges that are faced by children with NF1 include academic underachievement in areas such as reading, maths, or written expression. And this can be experienced in around half of children. Now, I am going to speak a little bit later about specific learning disorders, but they can occur in around 20% of children with NF1. Now, what the research also tells us is that intellectual functioning is generally found to be within normal limits. However, they can experience specific cognitive weaknesses in various areas in up to 80% of children. And this makes cognitive weaknesses one of the most common challenges faced by children. So our research suggests language, motor, and visuospatial skills can sometimes be impacted, but we found one of the key predictors of academic underachievement is a difficulty focusing attention and executive functioning. Now, I think a lot of you may have heard about executive functioning before or know a bit about it, but for those who don't, executive functioning is an umbrella term that refers to a group of cognitive skills that help you get things done, stay on track, and solve a problem to reach a goal. So it includes three core areas. The first is inhibitory control. So this is, it involves self-control, so being able to regulate your behaviours and your emotions. The second is working memory. And this is almost like your brain's yellow post-it note. So it holds onto information in mind, allowing you to mentally, juggle multiple pieces of information. So it could be, for example, a complex mental arithmetic problem in your head, or a lengthy instruction from the teacher, or even phonemes or the sounds in an individual word. So being able to hold them in your mind long enough to blend them together to make a word. So working memory obviously can have quite an impact sometimes on academic performance. The third core executive functioning is cognitive flexibility. And this is like having a mental gear shift in your brain. So it helps us smoothly transition between different tasks or ways of thinking without getting stuck. And it can help us to adapt to new situations or new challenges by shifting our focus. So together, these executive functions, which can sometimes be affected in NF1, help us initiate, plan, and complete goals. Now, the cognitive profile is often different for each child with NF1. Influencing their outcomes are the presence of medical complications such that do sometimes occur in some children, including central nervous system tumours, epilepsy, and whole gene deletions. So for children who are experiencing difficulties in these areas, a neuropsychological assessment may be helpful. Neuropsychology deals with how the brain impacts cognition and behaviour. So we use paper and pencil tasks to understand how a child thinks and learns. And there's a number of reasons why this type of assessment might be beneficial to kids with NF1. So we can identify early learning and motor difficulties so that we can offer early intervention and recommendations for that. It's also an optimal way to learn how your child learns and what their cognitive strengths and weaknesses are. Our job, our job is to understand the crux of an issue for a child in terms of their academic performance. So for example, if a child is experiencing difficulty with reading, it could be due to an attention issue, it could be due perhaps from a language disorder, or it could be a reading disorder or not being able to access the curriculum. So it's our job to really understand what's going on and provide recommendations on where to intervene. And intervention can be anything from stimulant medication to speech and language therapy or classroom accommodation and strategies. A neuropsychological assessment can also screen and diagnose, if appropriate, a range of co-occurring disorders, including ADHD, autism, and a learning disability. Now, one of the common questions that I get is, when is a good time for a neuropsychological evaluation? So I wouldn't subject a child to an assessment if there are no concerns, but if you do see a difference, then try and get on a wait list as soon as you can. Now, the NF1 Learning Clinic at the Children's Hospital at Westmead does provide neuropsychological assessment for children aged 3 up to the years of 17 years, or if they are still in school. We offer a report with recommendations. We liaise with schools, although it's important to note we're not a therapy service. We don't offer ongoing psychological support. We do make recommendations, though, on what may help support your child's individual needs. So we accept referrals from managing paediatricians, geneticists, neurologists, and GPs, or other relevant medical specialists, and that can be done through Consult Med. And you can look through the details here. Now, as mentioned, children can underachieve academically for a wide range of reasons, including factors such as sensory impairment, so vision and hearing, behavioural and poor attention, emotional issues, English is not an additional language, high absenteeism, or even ineffective instruction. And it's expected that children having difficulties because of one of these issues, they do have the potential to achieve at age-appropriate levels once provided with school programs that incorporate appropriate support and evidence-based instruction. So just because your child is having a difficulty doesn't mean that implies it's a learning disability. It could be from a number of other reasons. Children with a specific learning disability, or SLD, have persistent difficulties in an area of academic underachievement that continues despite appropriate intervention. So there are a number of different SLDs, and you may have heard some of them, such as dyslexia. So this is an impairment in reading. There's also SLD impairment in written expression or writing, spelling, and a specific learning disorder with impairment in maths. We know from the literature that in Australia, the risk for an SLD is 5%, and this more than doubles to 20% for children with NF1. So this decision tree might be a helpful guide to some parents to help figure out what steps you might choose to take if you are concerned about your child's reading, spelling, or maths. It's been adapted from Spelled New South Wales website. So perhaps your child's in year 1 and you've noticed that they're having trouble hearing sounds in words or difficulty writing numbers, counting, or adding. It's a good idea to make a time to speak to your child's teacher and see whether their grades are in line with grade expectations. If they're not and you're concerned, that's a good time to speak to your doctor to go on the wait list for a neuropsychological assessment. So in the meantime, if you're still concerned, then you can speak to your, if you're still concerned, you can speak to your teacher and find out what strategies are being used to assist your child in their area of concern. If after that point you are still concerned, then you can ask your school if your child can be given the opportunity to participate in a small group intervention targeting their area of weakness. And the aim of this small group intervention is to reduce the gap between them and their peers. Now, if your child doesn't offer this type of small group intervention, it may be necessary to try and seek this intervention outside of school. Spelled New South Wales has a wealth of information that includes a whole bunch of information about the various types of interventions, evidence-based interventions out there, and different resources. So I encourage you to check that out if you are concerned. Now, in those children where after having this small group intervention for at least 6 months are still continuing to experience difficulty, then it might be a good time to see a qualified professional to assess for a specific learning disability. Students with an SLD require ongoing sufficient intervention and support so that they can continue to develop their literacy and numeracy skills. So while students are receiving this intervention, there's a range of different adjustments that can be made within the classroom. So not just adjustments to the environment, but also the curriculum, assignments, and type of teaching. And this is often done through what's called an individual education plan or a personalised learning plan. So this is used to document these adjustments. And the whole purpose of that is to enable the child to access and participate in education on the same basis as other students. Now, I'm not going to go through all the various adjustments that can be made for a child because it really needs to be on a child per child basis. But there is some great information on the Spelled New South Wales website for various types of specific learning disorders, the types of interventions that are available, as well as adjustments that can be made within the classroom. Another great resource is the Australian Children's Tumour Foundation. They've developed some wonderful resources for teachers and parents, including info sheets on various topics such as learning disorders, more information on executive functioning, a teacher's toolkit and information on transitioning to primary school and high schools. And they can also do presentations at your school to help them understand NF1. They also have these wonderful health kits, which are great for newly diagnosed families. And I encourage you to contact the CTF if you are interested in one of these health kits, which can be personalised to suit your child's age and developmental stage. So they've pictured one of them here, which is for young children. Now, I'd like to move on to other neurodevelopmental disorders that can sometimes occur in children with NF1, and these include attention deficit hyperactivity disorder, or ADHD, and autism spectrum disorder, or ASD. Before I discuss these conditions, I think it's important to note that much of the literature we have on what is underlying these conditions and how to support them is based on children without NF1. I think it's also important to note that when thinking about these things and how to support a child, we need to think about what it means for this particular child at this particular stage of development, as not every child or family is the same. Now, ADHD is a behavioural disorder. It's found in the general population in about 5 to 11% of children. Studies in children and adolescents with NF1 have demonstrated a higher risk, so around 30 to 50%. There's 3 types of ADHD, and this includes the inattentive subtypes, which we can see some of the symptoms on the left-hand side. It includes things like often failing to give attention to detail, is often easily distracted, often having trouble listening and following through on instructions, and often reluctant to engage in sustained attention. The second type is the hyperactive impulsive subtype, and this includes symptoms such as often having trouble remaining in their seat or running around when not appropriate, often squirming and fidgeting, often having trouble waiting turns or interrupting others, and often talking excessively. And then there is the combined subtype, which is a combination of both symptoms. Now, it's common for children to experience these types of behaviours now and again, but to meet criteria for ADHD, they need to have 6 or more symptoms within a subtype, and these behaviours have to be frequent, so often occurring in a number of environments, and it needs to significantly impact on their daily functioning, such as their school or relationships. In NF1, we know the most common type is the inattentive subtype, as well as the combined subtype. Our research has also shown that the more severe ADHD symptoms a child has, the larger academic difficulty and social difficulties. Now, if you are concerned that your child may have ADHD, the first step is to see a doctor, and they will most likely refer you to a psychologist and/or a developmental paediatrician. There's many disorders that can cause symptoms of ADHD that aren't ADHD, especially in young children. And it's important to have a proper assessment to rule out other causes of behaviour. So, for example, learning difficulties, anxiety, trauma, or even a sleep disorder. What we know about the potential cause of ADHD does come from children without NF1. So inside the brain, we have neurotransmitters, which are chemicals that can help brain cells communicate with each other. And in individuals with ADHD, there may be imbalances in these neurotransmitters, such as dopamine or noradrenaline, which are associated with focusing and impulse control. In NF1, it's thought that changes in the NF1 gene has downstream effects on the similar pathways and chemicals in the brain. The good news is that there's a strong evidence that stimulant medication can be beneficial for ADHD symptoms in NF1, with improvements seen in clinical trials that are being conducted. Medication also isn't the whole story. So the evidence-based recommendation in Australia is that both medication and behaviour therapy should be used and is most effective to treat ADHD symptoms. So what is behaviour therapy? So parents and teachers can use behaviour management skills to support children with ADHD. Children can also use these skills to cope with their symptoms throughout their lives. So a therapist or educator who has been trained in behaviour management can teach parents, teachers and children specific techniques or skills that will help improve those symptoms and behaviours. So the sessions typically focus on things like establishing a routine, clear, consistent consequences, reward systems, and positive parenting principles. These sessions can be individual, so you can seek them out through a psychologist in your community, or alternatively, they can be group sessions. And the programs have been proven to help parents develop a positive relationship with their child, but also help parents manage some negative behaviours and increase positive behaviours. ADHD Support Australia is a great resource that has a number of behaviour therapy courses for parents for children with ADHD. I've also listed a number of other sites here that do offer these types of behaviour therapy programs. Alternatively, if you decide that you'd like to do a one-on-one with a psychologist, I encourage you to speak to your GP first, as you might be able to access a Medicare rebate for a partial medical rebate for these sessions through the Medicare mental health care plan. Now, autism spectrum disorder, hereafter referred to as autism, has received a lot of attention in the last decade in NF1. It's a neurodevelopmental disorder defined by differences in social communication, social interaction, and restricted and repetitive behaviours. Now, studies employing well-established diagnostic instruments have suggested that autism prevalence in children with NF1 ranges from around 11 to 26% of children, and this is significantly higher than the general population, where it's thought that there's a 4% prevalence. Our research has examined the symptoms involved in NF1 and autism and have shown that some of the more common difficulties with social interaction and communication include difficulties with friendship, group play and imaginative play with other children, reduced quality and quantity of how a child tries to initiate a social interaction, as well as respond to a social overture from someone else, and a reduced ability to have a reciprocal conversation. Now, for people who don't have social difficulties, this seems quite easy, having a natural conversation. But for children who struggle in this area, there's quite a lot of skills involved in having a conversation that flows. So this includes things like starting an interaction with another child, learning how to and when to take conversational turns, learning to ask questions about the other person, the conversationer partner, their thoughts and ideas, rather than just talking about what you want to talk about, and learning how to get across your message. The good news is a lot of these skills can be improved through social skills interventions with a psychologist. Now, some of the more common restricted and repetitive behaviours that are sometimes seen in children with NF1 and autism include difficulties with minor change, sensory sensitivities, so for example, being sensitive to noise or certain textures of clothing, an unusual sensory interest, intense or encompassing narrow range of interest, so being very overly interested, an unusual intensity of interest in one particular thing, and echolalia, which is where a child may repeat back something just said. Now, it is important to note that these types of behaviours can occur at a high rate in a whole range of different medical conditions. It doesn't mean that they have autism spectrum disorder. To meet diagnostic criteria, a child would have to have significant impairment in all three areas at a level that is creating limitations to activities and joining in everyday life. Now, if your child has been diagnosed with autism or you're concerned about this, there are some resources I've shared here. Support typically involves comprehensive support with allied health, such as speech pathology, occupational therapy to focus on communication, language development, and social skills and play. I've also listed here Autism Connect, which is run through a maze. It's a helpline, and this provides information and support to families and carers of children with autism spectrum disorder. And it includes evidence-based information, advice, as well as various support options. The advisors on that helpline give expert advice in a whole range of different areas. So where to get an assessment and diagnosis, resources for school, NDIS, as well as a digital toolkit, which is called Autism What Next, which helps families navigate the first year following an autism diagnosis. The last resource I'd like to share is Positive Partnerships. So this provides free face-to-face workshops with parents of school-age children with autism, as well as for teachers and carers. I thought in this talk it'd be nice to talk a little bit about navigating the education system, as I think this can be overwhelming sometimes, and knowledge is power, in knowing sometimes how the education system works can sometimes be beneficial in advocating for your child. Schools are provided with funding to meet each school's individual needs and the needs of individual children. And there's a number of different levels of support within the school system, starting with support at the school level to integration funding support, which is individual funding for a child, to a support unit, which is a specialised classroom with special education teachers, to a specific school with a purpose for various reasons. Typically, we find children with NF1 aren't eligible for integrated funding support. Typically, the most common level support level for access by children with NF1 is the school level support. So this includes things like an individual education plan, teacher's aid, small group support, access to the learning and support team, and the school counselling service. If your child doesn't fall under any specific disability criteria or ADHD or specific learning disability, and they may just have a cognitive weakness in a particular area that seems to be impacting, they are still eligible for an individual education plan or a personal learning plan. You can also advocate for your child to be included in any school-based program, such as a social skills program. Now, intellectual disability is more rare in NF1. It occurs in around 4% of children, and it tends to be mild. And for this reason, they generally won't be able to access integration funding support, as this is for children who have a moderate or severe intellectual disability or some other type of disability. In terms of the New South Wales Department of Education, they classify disability as things like autism or a severe language disorder or physical disability or sensory disability. So as mentioned, children do tend, those who do have a mild intellectual disability tend to either access a regular class or a support class, and they access school level support. Just a quick note on applying for HSC exam provisions. So the NESA medical form, which I'll show you in a moment, is required to apply for such provisions. Provisions are not granted solely based on a diagnosis, but more on functional evidence. So for example, work samples from the teacher or comments from the teacher, as well as results on their reading and spelling tests or neuropsychological assessment results. This information is all freely available online through the Department of Education. There's a range of different provisions that may be allowed for various reasons, and you can access this and what is required to what evidence is required to access that provision online. But generally you will need to complete a NESA medical form, which I've pictured here. We're very happy if we've seen your child in the past for a neuropsychological assessment to assist with this form. Please do, though, allow us enough time to complete it. So prepare in advance and send us that form so we have enough time, as we do get quite a lot of these around term 4, year 11. So I thought I would finish up with some brief clinical trial updates. So I haven't really gone much in today about what the research suggests is underlying some of the cognitive areas in NF1. I really wanted to focus this talk more on practical strategies and avenues of support for various different concerns. But I will touch on it now. So from animal research, we know that changes in the NF1 gene results in changes to various neurochemical pathways in the brain, including the RAS-MAP kinase pathway, cyclic AMP, and certain neurotransmitters such as dopamine and GABA. And this research has led to a number of different clinical trials that target these pathways to treat cognition. Now, there's been a variety of randomized controlled trials and single-arm studies of pharmacological agents to treat cognition in NF1. These include RCTs that have targeted the RAS-MAP kinase pathway. So, for example, the STARS trial, which was in Australia. To date, these have not been found to be effective in treating cognition in NF1. Methylphenidate trials have also been underway. So methylphenidate is Ritalin that's thought to act on dopamine as well as a number of other neurotransmitters in the brain. And it has found to be effective in treating ADHD symptoms in children with NF1. We're currently also analysing data to examine whether Ritalin can improve other areas such as working memory and attention in kids with NF1. The Excel trial, which is trialling a HCN agonist, which is associated with GABA, is also currently underway in Europe to treat cognition in NF1. So hopefully that will be published soon and provide more answers on that question. And finally, there's a number of MEK inhibitor trials that are being trialled to treat not only plexiforms, but cognition, with the TINT trial that is being conducted in Australia and still underway. We are also trialling non-pharmacological treatments to treat cognition in NF1. So one I thought I'd like to focus on, which is still currently underway, and it's being trialled both here as well as Murdoch Children's Research Institute in Melbourne, is our trial on auditory FM devices. So investigators in Melbourne, led by Jonathan Payne, recently conducted a case control study to investigate central auditory neural function and functional hearing in individuals with NF1. So out of 44 children with NF1, their results showed that around 45% of the group had difficulties processing speech. So these children were also found to have abnormal auditory neural conduction. So basically what that is, that they experience difficulty hearing noises in hearing speech in noisy environments. So what's more interesting is that these auditory difficulties in children with NF1 was found to be associated with poorer phonological processing skills, which is a precursor to reading, as well as high levels of ADHD symptoms and autism traits. So basically, the more severe their auditory difficulties, the higher number of ADHD symptoms, autism traits, and difficulties with reading. What the Melbourne group then did is, so we know from so these types of functional or hearing difficulties are commonly found in children with ADHD and dyslexia. And trials in these children have shown that remote microphone listening devices are beneficial in treating these difficulties in these groups. So what are these? So I've pictured one here. So it's a wireless sound transmission device that optimizes the listening environment by improving the signal to noise ratio. So it consists of two parts. You have this microphone transmitter that is typically worn by the teacher, often around a lanyard on the neck, and speech signals are detected by a microphone, which is usually worn by the teacher, and then transmitted either digitally or via FM radio waves to a receiver worn by the child. And this is a very tiny, small little device that clips onto the back of the ear. A pilot study conducted by Melbourne involving 10 children was completed, and the aim was to investigate the feasibility and acceptability of using this remote listening microphone device in treating auditory processing. And what the results of this pilot trial indicated was that children were able to identify significant improvement in their classroom listening ability when the remote microphone system was activated. So we are currently running a randomised controlled trial of remote microphone listening device in children with NF1 and auditory deficits. And we aim to assess the efficacy of remote microphone listening devices in treating these deficits, as well as more distal areas such as reading, attention, speech perception, and literacy. We also want to understand what the longer impact of these devices are, where they'll wear them for quite a longer period of time, 3 months. Oops. Okay, so I would love to now throw it back to you, Alicia or Ruth, to go through some questions in case anyone has some for me.
Hi, thank you so much for that presentation, Natalie. It was amazing. It was really informative. We have got a couple of questions, and one relates to what you just discussed with the tap-in trial with the microphones in classroom, for the auditory processing, the Alice Meyer study. Now, there's just a question: should children with ADHD have their auditory processing tested?
So, look, auditory processing difficulties have been found in children with ADHD in the general population. And what I can tell you is that there have been randomized controlled trials that suggest the listening devices can sometimes help these children. Within NF1, we haven't really looked at ADHD and auditory processing as a different thing to NF1. It would just, anyone can take part in this trial. You can certainly, if you feel like one of your child's complaints is that I have trouble hearing the teacher in a noisy environment, or easily distracted and can't seem to focus on what she's saying, then yes, it might be worthwhile seeing an audiologist to have a look at their auditory processing.
Okay, thank you. Another question is, if an assessment was done on a child through Westmead Children's Hospital in Year 6, would it be suggested to do another assessment during high school years?
So just to...
The question, sorry, that wasn't related to the previous question. So I think they're referring to the learning assessment you do at Westmead. If they've had one done in Year 6, would you suggest they have another one during high school?
So if they've had one in Year 6 in preparation for the transition high school, then typically we tend not to see children again until probably Year 11 or 12. However, and that's in order to potentially assist with special exam provisions, or to when they're transitioning out of paediatric care into the adult space, which doesn't have as many resources for neuropsychological assessment. The only reason why it might be warranted to have an assessment between that time is if there were new concerns that arised that weren't there when he was in year 6 or she was in year 6.
Okay, thank you. One final question is a child turning, and this is probably quite specific, a child turning 5 in January with NF1 with learning difficulties and communication difficulties, would it be better to hold them back basically for another year? That's
so when you say learning difficulties, I guess potentially cognitive, if they're only in year 5 and not in school yet, potentially they're having difficulties communicating it with language.
Yeah.
It's really a case-by-case basis, that decision. It's not something where I could offer you a blanket rule on. So it's something that you would probably want to speak to your speech pathologist about, because I'd hope that they'd be having some sort of speech intervention, and to meet with the prospective school principal as well and talk to them, as well as the child's paediatrician.
Right, okay. Sorry, there are a couple more questions that have popped up. One is there's a child with NF1 who is 3 showing signs of ADHD and autism, asked the only neuropsychologist that they could find in Adelaide whether he should be assessed, and he said 6 to 8. I'm assuming that means 6 to 8 years. Would you agree?
So autism can be diagnosed as early as, well before 3 years of age. So I don't believe, if there are concerns that a child has autism spectrum disorder, then I don't believe waiting is beneficial. As we know, early intervention can help support these children. Often what we find in NF1 though is it's harder to detect in NF1 because often there's diagnostic overshadowing, or it's difficult to pick up when there are many other comorbidities such as ADHD or sensory issues in terms of hearing or vision. So it is harder to detect at younger ages, but no, I don't believe waiting is such a great idea if you do have concerns with that, and best to be guided by a paediatrician and developmental team.
Sure. We have another question relating to social language disorder and whether that's quite common with children with NF1.
So I'm not across the literature in terms of whether there's been any studies on social language per se. In fact, language in itself has not been examined in great detail in children with NF1. We know we are about to publish, led by Jonathan Payne in Melbourne, we are about to publish our findings on our PANDA study, which is looking at the frequency and phenotype of autism in children with NF1. And as part of that, we do look at social language. So hopefully those findings will be published soon.
Okay. What else have we got here? Sorry, there's just a few more rolling in. I think that one we can probably answer. There's a question relating to tutoring, whether or not this is helpful. I assume that would be, again, something dependent on the child. Yeah, I think that's probably the most relevant. There is one here relating to the listening device trial, but we can probably refer them to that one. Unless you have any advice, Natalie.
Which question's that, sorry?
There's a question about my son has a short attention span, doesn't complete models, doesn't like reading, doesn't read well, but this is quite a, he'd like to trial a listening device to see if we can improve his school experience. Is this possible?
So as part, I mean, it depends if it's referring to the clinical trial, it depends if they're eligible for the trial. So they would need to go to Melbourne or a hospital and be screened for that trial to see if they're eligible and whether it's a good fit for them in terms of, do they have the issue with auditory processing, and if so, do they meet eligibility criteria? So yeah.
Okay, I think that's pretty much all of them. I think that as in relevant to, I'm sorry, there's more coming through here. There is a question. Belinda Barton's works have highlighted how early mother intervention can make a difference. What would such intervention be?
Look, I'm familiar with Belinda Barton's work as she worked at our hospital. I haven't heard of early mother intervention. It's not something I know from her. I know her work well. Do they mean just early intervention, perhaps? Or do they mean parent-child interactions?
I'm not sure. It just says how early mother intervention can make a difference.
Mm.
And one more quick question.
Can Lorenza clarify that a little more?
Oh, here we go. No, she hasn't yet. Just while we're waiting, there is another question just regarding, sorry, they're coming through thick and fast. What age is auditory processing able to be accurately assessed?
So I'm not an audiologist. We have quite a few audiologists on our clinical trial team, both at Melbourne and Sydney, who would be much better at answering that question as an audiologist. So I'm afraid I don't know the answer to that one.
No, that's fair enough. Okay, sorry. Lorenza's question, it was during the 2020 medical symposium. On her plot graph, several dots were off a chart. A member of the audience asked about those, and this was her answer.
Yeah, look, I know her papers well,
sure.
and I don't believe there's anything in them about early mother intervention. Perhaps she just meant early intervention, but I can't speak for her, I'm afraid.
Yeah, no, that's fair enough. I think are we almost out of time, or have we got time for any more questions? Have we got time for any more questions? Sorry, or are we almost out of time?
Yeah, are you talking to me?
Yeah, Alicia or you. Have we still got time for a couple more questions?
I'm happy to answer one or two more.
Sure. No worries. There is a question regarding a sensory diet for a child with NF1 and ADHD. I'm not sure if that's something you have any information on.
Yeah, so we've looked at sensory processing in children with NF1 and found it to be very frequent and a common issue. So for those who don't know, sensory processing can be difficulties there's various types of challenges there in terms of being sensory seeking or sensory avoiding, where they want to avoid or seek out sensory information in their environment. It can be visual, auditory, needing constant movement, as this member has mentioned. We know around 60% of children with NF1 do have issues with sensory processing, and it is related to, it's associated with quality of life and how they interact. In terms of interventions for sensory processing, there's emerging evidence about various sensory integration therapy and diets, like they've mentioned. The evidence isn't quite there in terms of being a large, good quality evidence, but it is emerging. So certainly a space to watch. So I guess the answer to that question is it's never been trialled in NF1. In the general population, it's emerging and it's not quite there yet.
Okay. All right, I think that's probably as much as we have time for. But thank you so much for everyone attending, and thank you so much for your time, Natalie.
Oh, you're
Thank
very
you, Natalie.
Hopefully it's been of some help.
It's been great. Thank you. Oh, also, just quickly, someone did mention, could we share the slides? I'm not sure if that's something we can do or whether we can just wait until the recording is released.
I'll let you guys decide that. I've sent the slides to Alicia and
Oh, okay, no worries. I'll let Alicia answer that.
Yeah, up to you.
Great.
Okay.
Thank you so much, Natalie. Thank you,
Thank
everyone.
you.
Thank you.
And thanks for everyone for joining.
Thank you. Bye.
Bye.